Yes, well, good afternoon, and at an earlier time, 1 o'clock. And so I'm going to give you some updates on the numbers, of course. And here we are on Thursday. How has the week gone? And with our numbers, and challenge with some of our data stuff there. So we're trying to update you on that as well. So the week, we did start off, remember, early in the week with 115. Then we went down to what we thought was a really low 33, but there was a data entry issue, and that was probably artificially low. It was probably closer to 50 or over 50. Then we went to 95, and today we're at 78. But I would add in the 78 that that number, we're missing some of the data from the Toronto Public Health System in their database called CORES system, and that was not available. So I would estimate, because they've been averaging before about 19 to 20, that maybe we have to add some numbers to the 78, so we may be closer to our 95. Anyways, such is a challenge when you're using different databases, even as we're converting over to new databases here in Ontario to allow much more prompt reporting, but that means sometimes there are some implementation, data adjustments, data cleansing and correction that has to occur. And as always, we're going to try and make you aware of when we think there is some need to look at our numbers with a little bit more scrutiny, especially the 78, and I would say it's probably higher than that. I don't think we're over 100, so I think that's the good news. We're probably close to that. The 28 of our 34 health units are not having data entry problems, have reported fewer than 5, and 19 with no cases at all. So we still have that low number, and we still are moving in the right direction. A lot of our Ontarians have resolved, another 99, so we're at over 90, pretty well 91% have recovered. That's 36,689, and that's a pretty substantive number, and that's good news. The deaths, we still have no deaths today, so that's good again, and that's always a positive thing to note. Most of our cases, as I'm saying, even though they're not documented in our thing today, are in Toronto, Peel, Ottawa, and still some in the Windsor-Essex area, but their numbers are steadying and coming down as well. Our hospitalizations continue to decrease, and our ICU patients at the same time are remaining stable. So that's good news. Our testing, we're still over 20,000, and our number of testing yesterday was 29,626, quite a large number, and our positivity rate was down to 0.4%. And I said, watch that number. That's an important one to look at as we see how that's trending over time. And in the past, even 2 weeks ago, we were 1%, 9.9%, but now we seem to be consistently somewhere between 0.6 down to 0.4. And so this steady dropping, in spite of large number of tests being done, gives us affirmation that we're not missing too much in that regard, because we're still asking people to come forward and getting tested if they are symptomatic, if they are concerned they've had a contact with a case, or if they feel they've been exposed in large numbers to some case contacts, they can go and get tested, and we're still encouraging them to do so. So our trends have been consistently, even week over week, are coming down, and our 602 cases reported is lower than our 804 average for the whole week. So day by day coming down, week over week coming down, and that's encouraging. The number of cases among our farm workers is coming down as well, and so that's encouraging. So overall, the direction is positive, and we want to continue that because now we're all at stage 3. And as always, our message has been, and this is why it's important when we're looking at going into school opening, is that we have said all along, when we move from phase 1 to phase 2, which was stage 1, 2, and 3, in stage 1, and before stage 1, we said, stay home if you're sick, stay home if you don't need to go out, hand hygiene, 6-foot distancing, 2 meters, and no large social gatherings. Stage 1, we said the same thing, and we added some other aspects around public gatherings in there. And social circles came in stage 2, but still, stay home if you don't need to go out. If you're ill, don't come out. If you need to get tested, go get tested. And we added masking in public places where you can't maintain the social distancing. That didn't change. Now in stage 3, even though we've opened up more, and 50 indoor, 100 outdoor, but personally, same messages. If you're sick, stay home. If you need to get assessed, get assessed. Hand hygiene, masking in public places. And these messages are continuing. Why is that important? As we're thinking about opening schools, the better you do in stage 3, the more the numbers come down, the more the percent positivity goes down, the less there is in the community. If there's less in the community, as I've already seen before, there's less in our congregate settings, long-term care, retirement homes, other congregate setting places, and schools. So this is all investment as we continue to go forward. Some other areas of the world have not only backed off on some of their overall large gathering restrictions, but also on personal behavior restrictions. We're not recommending that at all. We're asking, saying, as we open up more, be more vigilant on your personal protection. Be more vigilant on your consistency with public health measures. Be more vigilant on your social circles. We know some are getting casual on that. We hope to have some recommendations on that soon. Be vigilant in your cohorting. And that's what we're saying also. So we're going to come up with some more messaging as time goes on related to school openings, because it's like a congregate setting, part of our community. And as always, how we prepare our children for school, if we're doing things as far as stage 1, 2, and 3, when they're out in the public, we would like them to do the same and other things in the school setting, same as we have with other settings and that. And I hope to be commenting on as we go forward that those measures are in place. And also we're doing in the public setting in stage 1, 2, and 3, we didn't drop back and do less testing. We're doing more testing. We're doing monitoring. We're doing assessing. We're going after case contact management assertively. We're informing you as the public, what is the status in your area? What is the local health unit saying the cases are in your area? If there's cases, are they outbreak related? Have you been contacted or related to the outbreak? We're going to let you know as soon as possible and deal with that containment as soon as possible. So we're not going into stage 3 and on beyond that with the pretense of saying we don't think there'll be any cases at all. We know that's going to be a factor. We're going to look at cases and we're going to deal with it and inform you and deal with it aggressively. But you have to do your part as Ontarians, as you've done a great job so far, while the numbers are coming down, that you have to keep doing that kind of process on a go-forward basis, because we still have some movement internationally and we still have some aspects there that we're trying to contain and control and monitor and document. So the overall messaging I'm trying to say is that you're doing great. You need to keep doing well. And as we go to the next phase with schools, we even have to do that even better. And I'm confident that we can do that. But we have to do it in an informed, step-by-step method. And we're going to be coming up with information from public health, along with what the Minister of Education and the Ministry of Education is going to be announcing, other aspects related to the overall aspect of opening schools that I'm not going to discuss at this time. And I think he'll be discussing some things later this afternoon. So those are my comments here today, and I'm happy to take questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question.
Your first question comes from Haley Cooper with News Talk 1010. Please go ahead.
Thank you. Hi, Dr. Williams.
Hi, Haley.
Regarding classrooms and ventilation, there are some serious concerns being expressed by parents that the ventilation is poor and that windows don't open or at all or enough. So we were wondering if you've actually gone into schools yourself to check on the ventilation and windows, and are they sufficient?
So my answer to that is that the ventilation issue is one that the Ministry of Education is looking at and dealing with. And if there's some announcement that would come from the Ministry of Education, have I personally been in? I've been in my own children's schools, of course, and and I think the public health people have been in schools all the time, because we do have a public health school health program with our Ontario Public Health Standards. So our staff and public, they have been in there. Have they looked at the windows and the various components they're in? They have been concerned about air quality. We have had reports in the past about other things related to indoor air quality and concern about child health and student health, and that has been investigated from time to time when it's necessary. If you're asking about the overall status of the HVAC systems in the various institutions, as there are a wide variation in age and structure, I think that's a good thing that we'll be looking at and understanding better. But as you know, our pretense is that we're going forward with our public health measures under the understanding that it's droplet spread. Yet at the same time, we would like to make sure that there are no other air quality hazards in our schools, as we have continued to monitor that over years, and we'll continue to look at that issue in particular. But in regards to COVID, we're going to be looking for announcements from that or any aspects related to the work of the local boards of education as well as the Ministry of Education.
Follow-up?
Thank you. And my follow-up is regarding the flu vaccine. Will Ontario be supplying the vaccine early and encouraging people to get their flu shots early this year? Is the province stockpiling more than usual the amount of flu vaccine for this season?
Okay, 3 questions. We always try and get the vaccine out as early as possible. That depends on when the companies release it. That depends on how well they do their lot alignments and get them approved by the Bureau of Biologics with Health Canada. That means some of those things are under control and some things aren't in control. We only want to give out vaccine that has been approved, safe, and we always do that. And so as soon as we get it, we send it out. And because we get it from many companies, because of vaccine security, we don't want to depend on one company only. We get different amounts and different ones. And we have a variety of different vaccines and that are being supplied with. So, would we like to get it out as soon as we can? Yes, we do. We'd like to get it out to those who need it and are most vulnerable first. That means our long-term care residents, so our retirement home residents, as well as with our ones in seniors over the age of 65, and those with health conditions that we give to our primary care doctors and other physicians to make sure that their most susceptible ones are immunized first. As soon as we get it out, we're sending it out and distributing it. We're going to have a wider distribution system this year. We're ordering more vaccine than we did last year. Last year we had a record amount there. We still had an amount left over at the end of the year, so we didn't utilize. And so we're trying to look at how to improve our so-called vaccine wastage to make sure what we get is used to the maximum without running out. And so all these things have been working on intensely over the summer, and we've got that all ready to map and carry out. Because you have to remember, in Ontario, we're the only one with the universal immunization program, and we have that for almost now 12, 14 years. So we've been doing enough of that. We give out more vaccine flu than any other province and territory in Canada. So we're going to give that out and make sure it gets out. So it's a big program for us. It's an important program for us. And to get it out as soon as we can in a consistent, timely, and safe way is of primary importance to us. So we're getting ready for it again this year.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Doctor. Just wanted to follow up on this Muskoka situation. There was a group of 30 people at Deerhurst on the August long weekend. I gather they tested positive. 11 of them tested positive after they got home, and some of them were at a restaurant that's had to close this week while a server gets tested. What does this say about the risks that are still out there? But also, why can we not find out where these people tested positive to get a better sense of where the virus is? I think that's a concern of the local health unit up there, that they're not getting an idea on transmissions up there because things are being reported elsewhere where people live.
Correct. So, good point, Rob. And that's what we're saying with our tests. I mean, we're not running at 10 or 12 for the province. We're still close to 100. We're not out of the woods on this one at all. We're still asking people to do all those protection things that I talked about already, so I'm not going to say them all again, but that's critical. There's still some people who are being casual. There's still some people who are not following the public health measures. There's people, we understand, are having visitors from overseas that didn't quarantine for 14 days and showing up in a group gathering. That's not acceptable at all. And we should say, if someone shows up and says, you shouldn't be here. You haven't finished your 14 days. And we got to be firm on that. Plus, if you're exposed in group gatherings, you shouldn't be gathering more than in social contacts. I understand those ones at those gatherings were not exercising the 6-foot distancing. They probably weren't in the same social circles. They came from outside Simcoe, Muskoka. And we know where they got tested, and the health units are notified back with them, and they're tracking that. So this is where the health units work in a network on that basis there. Do we know beforehand, before they went up to Muskoka, that they were positive or they were getting tested? No, we don't know that. But at the same time, as we said before, all along, if you're going up to other areas, touristing up to northern areas, we've said, one, if you're at all suspicious that you've been in a case in contact, don't go. If you're positive, don't go. If you have signs or symptoms, don't go. Why? You can overwhelm the local health system. That message has not changed. If you do go, be respectful of the local situation. Maintain your social distancing. Wear a mask if you need to in a public gathering. And And also don't utilize the local resources if you're not intending to stay there. Those things are still in place. That means respecting those northern areas and acting responsibly in that way. So I think that was most concerning to the local medical officer of health, Dr. Gardner, and that still is occurring to some areas and tourist ones, that people are going up and not adhering to the public health measures that they would have adhered to back in the local area, and maybe they weren't adhering there either, as we've seen some outbreaks in some other parts of Ontario. So my message to that group there is that you should be responsible, you should understand that, and not expose, as you did, you expose local facilities to that, where you probably should have been more cautious, and not should, you must have been, you should have done that, and you weren't. And so that means now a local facility that was trying to open in stage 3 is closed until it's investigated. That's what happens. That's unfortunate. It means that some people were less than responsible and conscientious in handling things. So I think you've raised a good point, and I would want to reiterate all those messages I just said. Whether you're in one area and you're going to another one, you're still in Ontario. You still have to do that respectfully. You still have to adhere to the public health measures. And you can't say, well, it's a holiday, we let the standards slide. That's not acceptable. So we want to be that because we respect each other and we respect the people where we're going to. And if we're traveling there, we respect those local people, and we do not want to spread infections up that area in any way at all at any time. So it is concerning, and we want to make sure that's emphasized.
Follow up?
Yeah, doctor, thank you for that. Do you know if the people that were in Muskoka, this group, were any of them symptomatic at the time? Do you know any details of that, and what health units they've gone back to?
No, Rob, I don't have that kind of detail. That would be the local health unit, and then they would be contacting back to wherever these people's, because I'm sure if they registered, they would know where their home address is, and they would be talking to local health units, because some of that is personal confidential health information. So I don't have that information offhand. That would be within the realm of the medical officers of health.
Next question, and this will be the last question.
Your final question comes from Lisa Zing with CBC News. Please go ahead.
Hi there, doctor. Today, UHN is reporting there are no COVID cases in its hospitals as of 8:30 a.m. I just wanted to get your thoughts on that. Have we turned a corner generally? What are your thoughts?
I mean, yeah, we heard back, was it 3-4 weeks ago, time flies, that another hospital, major one in the Toronto area, had no cases either. And we see this across the province with because our overall monitor, the command table, we're looking at all the ICU beds, all the hospitalizations and cases and that, and we see this steadily coming down. Our number of hospitalizations have been decreasing in that. We're detecting cases sooner, and they're in that aspect there. So I wouldn't say we suddenly turned a corner. We've been moving down steadily. And UHN, with the size it is, it's a remarkable milestone to get that number down. That means as those are coming down is important, because we're seeing our hospital utilization go back up again with the backlog of other cases and aspects there. So it's not that those ICU beds and those hospital beds are empty. They're ramping back up to in the mid 80 and 90% capacity again, because there's a whole backlog to get to handle. So it's a good news story, and it means that these broader numbers we're looking at, as we're getting less and less of these every day in Toronto, in Ontario, there's less need to be percents going to hospitalization, because it was a fixed percentage. And there being less usage in ICU, less usage in ventilators, etc. So all good news in there. So I would agree, it's not like a sudden corner. It's been a gradual progression coming down, same as all the rest of our coming down, and more recovering in there. But there are still some in, and we wish them all the best in their hospital course and hopefully recovery.
Follow up, and this is the last question.
Thanks very much. And as you say, obviously the elective procedures and things like that are ramping up again. As we, head into fall, what would you say hospitals should be doing at this point, considering, as they do more elective procedures, but how do we also at the same time prepare for a possible second wave?
Excellent question, and very much the topic of discussions at our command table with Ontario Health. we're into the wider sector, healthcare sector, because not only affects hospitals, affects long-term care, retirement homes, the whole wider group, primary care and everything. So we're doing much discussion and briefing up on how do we prepare for various scenarios of a second wave of, there's different ones that their modelers are giving us. And so we have to look at that, and rather than saying, well, we're just going to see how things go. No, we're not doing that at all. We're ramping up a number of things and put in place in there, and I can't detail at the moment, but it's very much on the minds of our ministry, our Minister of Health, our cabinet office, etc., and they're all looking at those aspects there. The Premier's concerned and being briefed on it. So we are preparing. Would it be nice if we didn't have to? That would be great, but we're not going in with that pretense. So we're planning accordingly. So much discussion, much decision making at this time.
Thanks, everyone.